Hi, Mr. Singh. Good to see you and good to have you with us on the program tonight.
Good to be here.
Look, privately delivered, publicly funded healthcare does exist and has existed for a while in this country. Why are you coming out so strongly against it right now? Is it political? Is it because Doug Ford's proposing it?
It's about the direction we're headed in. And where I want us to go as a country is to invest more in the public healthcare. But really, it's also coming from the people on the ground who are telling us the problem that they're up against is the number of healthcare workers. And investing in a private, for-profit delivery is not going to fix the fundamental problem. And so I really want to put all of our resources towards dealing with the problem, because I'm afraid when I think about what that means for kids in our country, for aging population, for families that can't get the care they need, that this proposal is not going to fix that problem, keeps me up at night.
But what's the difference between what Doug Ford's proposing and the 8 million hours of publicly funded but privately delivered care that Quebec is going towards? What's the difference? That one is a political foe of yours and the other isn't?
Well, my concern is about for-profit private delivery everywhere in our country.
So you're worried about what Quebec's doing too?
Absolutely. I'm worried about it happening anywhere in the country, and I'm particularly worried about the crisis that we're in right now and the decisions we make right now with our public dollars at the federal level. If we want to solve this crisis, the priority has to be on hiring more workers. That's really what it comes down to. And if we're spending any money on private delivery, it threatens to take away those workers from the public sector and just make the problem even worse.
But how do you know that that's the case? Because let's say the government in Ontario is proposing is we have this massive surgical backlog, right? We're going to put all of this effort into recruiting staff, and we're also going to make sure that that staff, which has some limited time in hospitals right now because the capacity has been reduced, can work in private clinics as well so that those surgeries get cleared. Like, why can't both those things happen at once? Because
what it does, it sets up a direction of where our healthcare goes. Instead of looking at the fact that we've got public hospitals, we've got surgical beds, we've got equipment there, instead of putting more workers in filling that capacity, which is not at capacity, there's not enough workers to fulfill the demand in the public sector, we're having a parallel system that's just going to hire and pull away workers from the public system. It's not going to net fix the problem, which is not enough healthcare workers. And I want all of our efforts to go towards a solution, which is let's hire more workers, let's recruit them, let's retain them, let's find more training spaces for them. Let's put all of our energy towards the real problem, which is a shortage of healthcare workers. And in addition, we know that with private delivery, there's costs associated with it. We know there's lower quality, and there's got to be some money baked in for profit, which means all of our money isn't going towards care. All of that is a problem.
How do we know it's worse outcomes? How do we know that it's less effective? And I ask because, again, there are already cataract surgeries being performed here and here in Ontario and in other provinces, right? There are MRIs. I go get my lab work done. That's a private for-profit clinic. The results still come back. It's still, you know what I mean? Like, it's still helping to alleviate some of those capacity issues. How do you know that is the case, that there will be worse outcomes, and how are you presenting it as fact?
Well, a couple of things we know. First of all, the Ontario Nurses Association and the College of Physicians and Surgeons of Ontario, both the frontline healthcare providers, have said this is the wrong approach, it's going to make things worse. So I trust their opinion on this. They're the folks that are delivering the care. We also know logically that when we've got ER rooms that are at capacity and those frontline workers are telling me we don't have enough nurses, if we put more money into a private for-profit delivery, where are those nurses that run those clinics going to come from? Probably the public facility.
Or we could just pay them more in the public facilities and then they'd go to both.
I would say, why don't we just pay our workers more and hire more in the public service and deliver more care? And we know that that's a direction that BC is headed in. BC is actually buying up private clinics because they say it's more efficient, it's better delivery. And we know in terms of the experience that we have. But they let it happen
in the first place under an NDP government, right? They let more surgeries, more procedures be delivered through private means, maintaining that they were publicly funded. That's exactly what Ontario's doing.
But they're saying that was the wrong direction. And they're acknowledging that they did it, and now they're going the opposite direction because it's not the best delivery. So they're saying, yeah, we did it, but we realized that wasn't the right way to do it. We got to do it a different way, and that's why they're going towards more public delivery. Fundamentally, we know a couple of things when it comes to private care. We know that it costs more. Anytime we look at jurisdictions where there's a public-private mix, it costs more when there's more private. We also know that quality goes down, and long-term cares that are for profit, we saw the worst quality of care. It gives us an insight into what happens when you've got for profit. There is a large potential of reducing the quality of care or the hours of care to make more money. And then finally, when we know we're up against a shortage of workers, Having two parallel systems isn't going to solve the worker shortage, and that's fundamentally what we've got to fix.
So you're heading for this interview to meet the Prime Minister. Can you explicitly tell Canadians watching tonight what you're going to say on this to the Prime Minister? Are you going to ask, for example, for him to hold back money through the Canada Health Transfer if he determines that the direction of private sector involvement in the public system in a given province is going in the wrong direction?
Well, I'm not going to get into the details of this particular meeting, but I can tell Canadians in general what I've said publicly remains the same. I'm opposed to for-profit private delivery. I believe we should be putting our money into public delivery, and that there are tools that we can use to discourage for-profit delivery, and that's the Canada Health Act, and we should use that.
But what exactly does that mean? Does that mean that the Prime Minister in these negotiations that will commence on February 7th should say, hey, BC, you're going in the right direction, Ontario, you're not, so you're going to get less money?
How that's delivered or how that message is conveyed, there's lots of different ways to do it, but ultimately what I want to see happen is if we've got public money from the federal government going towards solving the healthcare crisis, that money has to go towards the fix, and the fix is hiring more workers. So I want to see our public money going towards fixing the problem and spend it on nurses, spend it on doctors, spend it on healthcare workers. That's what we need to do.
The reason I'm asking so specifically what the line is for you is because it appears to me like it's sort of nebulous, right? Like it's sort of slippery. Like, is the Prime Minister the one who's going to stand up there and tell provinces who ultimately have jurisdiction over healthcare that even though you meet the requirements of the Canada Health Act, you're getting a little bit too private for me? Like, how do you judge what is too much, and how does it not appear arbitrary?
Well, we've got a couple of things that we know the Prime Minister's already promised to do. He's promised to hire more doctors and nurses. Do that. That's something he promised to do. We heard the Prime Minister promise to pay healthcare workers more money. That's something we also agree with. To retain those workers, they need to be compensated appropriately. So let's put our money towards the solutions. Hire more workers and use that money for
provinces to hire more workers? Because again, the federal government is not doing it. The provinces are.
Well, the federal government's talked a lot, and the Prime Minister talked a lot about conditions. He touted that I'm not going to give money away without any strings attached. We think one of those strings attached should be ensuring that we're hiring more workers. That seems like a reasonable thing to do if all the healthcare workers in our country are saying we're up against a worker shortage, we're not able to provide the care in emergency rooms because there's not enough people, then we should be using our money towards hiring those people.
And that's a reasonable thing. They work in public places, not in privately funded clinics?
Oh, I absolutely believe we should be spending money, public money, on hiring workers that work in the public sector in a publicly funded universal system.
And you think it's the federal government's job to dictate to provinces that that is the case?
Well, absolutely.
Because Quebec's going to go nuts over that, right?
The Canada Health Act says really clearly that we should have a publicly administered healthcare system. And if the problem that we're up against is the lack of healthcare workers, we shouldn't be spending our public money on giving rich corporations more money or private clinics more money that are for profit. We should be spending that on public service for sure.
Okay, I have to leave it there. I'm out of time. I know you have to run. Thanks a lot, Mr. Singh.
So
Appreciate your time.
Thank you.